Counterfeit masks have made their way into Care New England facilities.
The healthcare organization saying some staff were given Make-Right N95 masks that weren't the real deal. 12 News reporter Brandon Truitt is live near Kent County Hospital in Warwick with how this happened and ways you can keep it from happening to you. Brandon?
Well, guys, Care New England says they ordered these masks months ago. They've been sitting in a warehouse ever since then. All of that during that mask rush we had earlier in the summer. Well, when they started using them, they say everything looked fine, but they didn't fit.
We expected that they wouldn't fit everybody, but it was uncommonly a larger fail rate than we would have thought.
It was a series of fit tests that led Care New England to realize the N95s they had purchased from a vendor weren't the real deal.
It's a very small portion of our workforce that is fit tested with a Make-Right mask, less than 5%, so it's not a lot of people.
Care New England getting in contact with any employee that might have had one, telling them to get rid of it. They say they have others. All of this because part of an order of 11,000 masks from Make-Right were counterfeit.
We had the shipping information, the invoice information, everything seemed to be authentic, and so we had no reason to believe they were not authentic.
So if it happened to them, could it happen to you? These are medical grade masks used for doctors and nurses treating COVID positive patients, but there have been cases across the country of counterfeit PPE. Make-Right's own website warns of the potential scams, giving a heads up on fake vendors using their name. The CDC, with a list of its own, they have their own tips on how to spot the fakes. For N95s, check to make sure the mask has markings on the facepiece. If it's missing an approval number on the mask or headband, it's likely not a true N95. Look for the National Institute of Occupational Safety and Health initials. And remember, NIOSH doesn't rate these masks for children. If the product says it's approved for them, it's not legit. As for Care New England, they're now retracing their steps, working with the state to figure out where these came from and who's responsible.
It's really disappointing that somebody would prey on the people who I think are heroes at this point.
So I reached out to Lifespan as well. They say they have these type of Make-Right N95 masks, but they've never been handed out. They don't have plans of using them. We did reach out to Make-Right multiple times for this report today, and so far we have not heard back. Live in Warwick, Brandon Truitt, 12 News.
New information tonight on how Rhode Island's second largest hospital group ended up with thousands of fake protective masks. And it's not just a problem for Care New England. 12 News reporter Brandon Truitt joins us live now with what he's learned. Brandon?
Kim, we are talking about 11,000 masks that are now headed for the trash. Care New England saying they were duped here. They caught this early, but now they're trying to figure out how it happened.
It's really disappointing that somebody would prey on the people who I think are heroes at this point.
A bad batch of masks sold to one of Southern New England's most prominent healthcare organizations.
We had the shipping information, the invoice information, everything seemed to be authentic, and so we had no reason to believe they were not authentic.
Robin Neal with Care New England saying these masks came from a vendor of Make-Right. The company sources PPE globally, but that vendor was selling fake supplies. Care New England noticing the problem after employees tried them on. They looked normal, but they didn't fit.
We expected that they wouldn't fit everybody, but it was uncommonly a larger fail rate than we would have thought.
So they're pulling them, all of them. This order impacting roughly 5% of the Care New England workforce.
We are in the process of notifying each person individually.
But it's not just happening here. Make-Right's website has warning after warning of counterfeit products. The CDC has a list too. And just last month in Chicago, U.S. Border and Customs agents pulling $3 million worth of masks after part of this order was deemed counterfeit. Back in Rhode Island, the Department of Health is working to figure out how this happened, with doctors and nurses stuck in the middle.
They're the frontline workers, the patients caring for COVID patients, and that somebody would sell a fake respirator to a healthcare organization or distributor to be used by a healthcare organization. It's really disappointing.
And just in the last 15 minutes, the Rhode Island Department of Health getting back to me saying that they have not seen this at other healthcare facilities. However, they say they are working with them in an effort to catch any potential issues like this in the future. Live in Warwick, Brandon Truitt, 12 News.